So the Stratus variant and the Nimbus variant, those are two of the ones that we're seeing right now, actually are both equally good at infecting a host. They are not, however, associated with more severe illness like we've seen with other strains in the past. So you can easily catch it and you can easily spread it. How do we know that's happening? Because we track the percentages of cases that come in for the variant. And as you can imagine, from May to June to now in August, we are seeing climbing percentages of both Nimbus and Stratus as part of all of the COVID variants that we see. We have seen more sore throat, more hoarseness of throat, that kind of horrible complaint that I can't talk, I can't swallow happening. But with regard to hospitalizations, we're actually not seeing more of those than we had in the past few months when other variants were present. Can this change over the fall and winter? Absolutely, it can. These variants have many sites of mutation from the original strains that we had back in 20, as well as in 2022 and 23. So that means COVID is going to continue to mutate. The more people that get it, the more they pass it, the more mutations that happen. So that means the fall and winter are going to be primed for us to see more infections and probably with different variants. What's the advice we give to families? If you or your child has COVID, it would be not a bad idea to stay home until you're not coughing and have fever. Because if you have fever and you're going to work or your kid is going to school, they're probably going to pass that variant to the next kid or the next adult and on and on. I think the first step with regard to vaccination is knowledge about the vaccine. Yes, there are several mRNA vaccines out there. mRNA vaccines do not have any mercury in them or thimerosal in them. And the way I tell families to know that is because it's a single dose vial. Any vial that we take more than one dose out of means there's a preservative in there like thimerosal. But if it's one vial, one person, there's no thimerosal, there's no preservative. So that's really important for families to understand. The second is there's nothing live about this vaccine. The vaccine is not going to cause an infection in anyone. And the way it works is to use your body's cell machinery to make antibodies. And that's really good for us because antibodies will protect the rest of the cells. So by giving a COVID vaccine, you kind of turn on the machinery. Unfortunately, when you turn on the machinery, you feel under the weather. You may have some fever and some body aches, but that's because your body is a good immune machine and it's making antibodies. It would have done the same thing, perhaps even more so, if you had an infection. So the good news is you're causing your body to be protective for all the other cells. So we like the vaccines for that reason. We are especially concerned for the fall and winter for older populations, as well as populations with underlying lung issues, because year after year, we've seen those are the people who wind up getting COVID and getting sicker. They come to our emergency rooms, they get admitted to our ICUs, and far too often they don't do so well. So depending, again, who are you? What are your underlying medical conditions? You should talk to your doctor. Are you the right person to get a COVID vaccine? In the past, people have said, oh, kids don't get so sick with COVID. They don't need a vaccine. As someone who worries about even one child getting sick, I tell families, think about who your kid is and who else is at home with you. Does grandma or grandpa live with you? Are you staying away from them or staying with them? You may need to circle around that person and have everyone protected so that they're not going to bring it home to that individual. I think it's important to recognize the American Academy of Pediatrics is very upset that COVID vaccine is not being recommended for school-age children. As a parent whose kids have been sick in the past, none of us want to stay home when our kids are sick and they have to stay home. The only way to prevent children from missing school and us from missing work is through vaccination.